Welcome to our deep dive into healing after periodontal therapy. In this video, we'll explore the fascinating processes that occur in your gums and supporting tissues following treatment for periodontal disease. Healing isn't just about closing wounds, it's about how the body restores, repairs, and sometimes even regenerates the structures that support your teeth. We'll break down the differences between regeneration, repair, new attachment, and reattachment, and see why each is important for a healthy mouth. Let's start by understanding the key aspects that determine the outcome of periodontal treatment. Regeneration is the biological process by which the architecture and function of lost periodontal tissues are completely restored. This means that after successful therapy, new periodontal ligament, alveolar bone, and cementum are formed, bringing the area back to its original state. Regeneration is the gold standard in periodontal healing because it doesn't just patch things up, it rebuilds them as they were before disease or injury. Achieving true regeneration is challenging but crucial for long-term dental health. Repair is another possible outcome after periodontal therapy. Unlike regeneration, repair involves healing of the tissues without fully restoring the original architecture or function. The tissues close up and the area stabilizes, but the specialized structures that were lost, like the periodontal ligament or bone, are not completely rebuilt. Repair is still a positive outcome, as it helps protect the tooth and surrounding tissues, but it doesn't offer the same long-term benefits as true regeneration. New attachment refers to the reunion of connective tissue with a root surface that has been pathologically exposed due to periodontal disease. This process is essential for restoring the connection between the tooth and its supporting structures. Unlike simple repair, new attachment means that the tissues are re-establishing a functional bond with the root, which is critical for tooth stability and health. This outcome is a key goal in advanced periodontal therapies. Reattachment is the reunion of connective tissue and a root surface that have been separated by incision or injury, not by disease. This is different from new attachment, which deals with areas previously affected by periodontal disease. Reattachment is important in surgical procedures, where tissues are intentionally separated and then brought back together. Proper reattachment ensures that the tooth remains stable and the supporting structures heal correctly. During the healing stages of periodontal pockets, the area is invaded by cells from 4 different sources: epithelium, gingival connective tissue, bone, and the periodontal ligament. Each of these cell types plays a unique role in the healing process, and the sequence in which they arrive can determine the final outcome. Understanding these cellular dynamics is crucial for predicting and guiding periodontal healing. If epithelial cells are the first to populate the healing area, they tend to proliferate along the tooth surface. This leads to the formation of a long junctional epithelium. While this outcome helps seal the area and protect against further infection, it doesn't restore the original attachment apparatus. The result is a functional, but less ideal connection between the tooth and the surrounding tissues. When cells from the gingival connective tissue populate the healing area, the result is the formation of fibers that run parallel to the tooth surface. This outcome leads to remodeling of the bone but does not result in new attachment to the cementum. While the area stabilizes, the original structure and function are not fully restored. This is considered a form of repair rather than regeneration. If bone cells are the first to arrive at the healing site, the outcome can be less favorable. Bone cells may cause root resorption and ankylosis, where the tooth becomes fused to the bone. This eliminates the normal periodontal ligament space and can compromise tooth function. Such outcomes are generally undesirable in periodontal therapy. The ideal scenario is when cells from the periodontal ligament proliferate coronally into the healing area. These cells can form new cementum and periodontal ligament, leading to true regeneration. This process restores the original architecture and function of the supporting structures. providing the best long-term outcome for the tooth. Melcher emphasized that regeneration of the periodontal ligament is the key to new attachment. The periodontal ligament provides continuity between the alveolar bone and the cementum, and contains cells capable of synthesizing and remodeling all three connective tissues of the periodontium. This insight has shaped modern approaches to periodontal therapy, focusing on promoting ligament cell proliferation for optimal healing. To summarize, the outcome of periodontal healing depends on which cells populate the area first. Epithelial cells lead to long junctional epithelium. Connective tissue cells result in parallel fibers. Bone cells may cause resorption or ankylosis, and periodontal ligament cells enable true regeneration. Each pathway has different implications for tooth stability and long-term oral health. Let's look at a visual summary of the sources of cells that populate the periodontal pocket during healing. This schematic helps us understand how each cell type contributes to the final outcome, and why guiding the right cells to the area is so important in periodontal therapy. A flowchart can help clarify the sequence of events during periodontal healing. It starts with the initial injury or treatment, followed by the migration of different cell types. The final outcome depends on which cells dominate the healing area. This visual guide is useful for both clinicians and patients to understand the complexity of periodontal healing. Regeneration is the ultimate goal in periodontal therapy because it restores both the structure and function of the supporting tissues. This leads to better tooth stability, improved oral health, and a lower risk of future periodontal problems. Modern treatments aim to promote regeneration by encouraging the right cells to populate the healing area. Achieving true regeneration is challenging. It requires precise control over the healing environment and the types of cells that populate the area. Factors like infection, patient health, and surgical technique all play a role. Despite these challenges, advances in materials and techniques are making regeneration more achievable than ever. It's important to distinguish between repair and regeneration. Repair stabilizes the area but doesn't restore lost structures, while regeneration rebuilds the original tissues. Both outcomes can be beneficial, but regeneration offers the best long-term prognosis for tooth health. Understanding the healing process after periodontal therapy helps clinicians choose the best treatment strategies. By promoting the right cellular responses, dentists can improve outcomes and help patients maintain their teeth for life. Patient education and follow-up care are also essential for successful healing. Patients play a crucial role in the healing process. Good oral hygiene, regular dental visits, and following post-treatment instructions all help create the best environment for regeneration and repair. Patient cooperation can make the difference between a good and a great outcome. Healing after periodontal therapy is a gradual process. Initial closure of the wound may occur within days, but true regeneration and remodeling can take weeks or even months. Patience and consistent care are necessary for the best results. Signs of successful healing include reduced pocket depth, healthy gum color, and stable teeth. Absence of bleeding and discomfort are also positive indicators. Dentists monitor these signs during follow-up visits to ensure the healing process is on track. Sometimes, healing doesn't go as planned. Complications like infection, delayed healing, or unwanted tissue responses can occur. Early detection and intervention are important to address these issues and get healing back on track. Growth factors are proteins that stimulate cell growth and differentiation. In periodontal therapy, they can be used to promote regeneration by encouraging the right cells to populate the healing area. Research into growth factors is opening new possibilities for improved healing outcomes. Modern periodontal therapy often uses biomaterials like membranes, grafts, and scaffolds to guide tissue regeneration. These materials help direct cell migration and protect the healing area, increasing the chances of successful regeneration. Various surgical techniques are used to promote regeneration, including flap surgery, bone grafting, and guided tissue regeneration. The choice of technique depends on the specific clinical situation and the desired outcome. Non-surgical treatments like scaling and root planing can also support healing by removing bacteria and creating a clean environment for tissue repair. These approaches are often the first step in periodontal therapy. Regular follow-up visits are essential to monitor healing and address any issues early. Dentists may adjust treatment plans based on how the tissues are responding, ensuring the best possible outcome for each patient. Educating patients about the healing process and the importance of oral hygiene can greatly improve outcomes. When patients understand what to expect and how to care for their teeth, they are more likely to achieve successful healing. Smoking can negatively affect healing after periodontal therapy. It reduces blood flow, impairs immune response, and increases the risk of complications. Patients who smoke should be encouraged to quit for the best healing outcomes. Systemic health conditions like diabetes can also impact periodontal healing. Managing these conditions and working closely with healthcare providers helps ensure the best possible results after therapy. Good nutrition supports the healing process by providing the body with the nutrients it needs to repair tissues. A balanced diet, rich in vitamins and minerals, can make a significant difference in recovery after periodontal therapy. Age can influence the healing process. Younger patients tend to heal more quickly, while older adults may experience slower tissue regeneration. Individualized care plans take age and other factors into account for optimal results. Certain medications can impact periodontal healing. For example, drugs that suppress the immune system or affect blood clotting may slow recovery. Always inform your dentist about any medications you are taking. Genetic factors can influence how well a person heals after periodontal therapy. Some individuals may be more prone to inflammation or slower tissue regeneration due to their genetic makeup. Personalized treatment approaches can help address these differences. Inflammation is a natural part of the healing process, but excessive or prolonged inflammation can hinder recovery. Managing inflammation through proper care and, when necessary, medication is important for optimal healing. Dentists use various tools to monitor healing, including probing depths, radiographs, and clinical exams. These assessments help track progress and identify any issues early, allowing for timely intervention. Long-term maintenance is essential for preserving the results of periodontal therapy. This includes regular cleanings, checkups, and ongoing oral hygiene. Maintenance helps prevent recurrence of disease and supports lasting oral health. Patient motivation is a key factor in successful healing. Staying committed to oral hygiene and follow-up care ensures the best possible outcomes. Support from dental professionals can help keep patients on track. Research in periodontal healing is ongoing, with new therapies and technologies on the horizon. Advances in stem cell therapy, biomaterials, and personalized medicine hold promise for even better outcomes in the future. Many patients have experienced remarkable improvements after periodontal therapy. Their stories highlight the importance of proper treatment, patient cooperation, and ongoing care. These successes inspire others to take charge of their oral health. Successful periodontal healing often involves a team approach, including dentists, hygienists, and sometimes specialists. Collaboration ensures that all aspects of care are addressed for the best possible outcome. Technology plays an increasing role in periodontal therapy and healing. Digital imaging, laser treatments, and advanced materials help clinicians plan and execute treatments with greater precision and predictability. Many resources are available to support patients during healing, including educational materials, support groups, and online forums. Accessing these resources can help patients stay informed and motivated throughout their recovery. There are many myths about periodontal healing, such as the belief that gums can't heal or that surgery is always required. In reality, with proper care and modern therapies, significant healing and even regeneration are possible. Healing after periodontal therapy is a complex but fascinating process. By understanding the roles of regeneration, repair, new attachment, and reattachment, both clinicians and patients can work together for the best outcomes. With advances in science and patient cooperation, the future of periodontal healing is brighter than ever.